Imagine waking up every morning, reaching for your trusty bottle of multivitamins, and swallowing a handful of pills with your coffee, believing you're doing your body a favor. You've been told for years that vitamins are the key to staying healthy, especially as you age past 65. But what if those very supplements, the ones you take so faithfully, are silently working against you? What if, instead of boosting your health, they're increasing your risk of serious conditions, brain shrinkage, heart failure, stroke, or even early death? According to a study published in the Journal of the American Medical Association, seniors who take the wrong supplements face up to a 40% higher risk of mortality. This isn't fear-mongering or clickbait. It's clinical data backed by decades of research. Some vitamins, when taken in excess or in the wrong form, can accumulate in your aging body, poison your cells, and mimic the symptoms of growing old, symptoms you might dismiss as inevitable. The truth is, these issues are often avoidable. Your liver isn't as efficient as it was in your 40s. Your kidneys struggle to flush out excess nutrients, and your nerves are more fragile than ever. Yet certain vitamins pile up, causing damage you might not notice until it's too late. Let's start with the ones you need to avoid. The supplements that could be doing more harm than good for those over 65. Then we'll move on to the 4 essential nutrients your body craves daily to keep you sharp, strong, and living longer. One of these, according to a major European study, is linked to a 36% lower risk of death from all causes, a statistic that could change how you approach your health. But first, we need to talk about the dangerous ones, starting with a vitamin that seems harmless but can quietly wreak havoc over time. Consider vitamin A, specifically in its retinol form. At first glance, it sounds like a hero nutrient. It's essential for vision, supports your immune system, and keeps your skin healthy. Who wouldn't want that? But for seniors over 65, especially those popping multivitamins or taking liver-based supplements, too much retinol can lead to a toxic overload. Unlike water-soluble vitamins that your body flushes out, vitamin A is fat-soluble. It doesn't just pass through. It lingers, storing itself in your liver and fatty tissues. As you age, your liver's ability to process and clear these stores slows down, and your fat distribution changes, meaning the vitamin A you take today doesn't disappear, it builds up. Over time, this accumulation becomes toxic, and the symptoms are insidious. You might notice dry skin, dizziness, blurred vision, or joint pain. These are easy to shrug off as signs of aging, but they could be warnings of chronic vitamin A toxicity, especially if you're taking more than 2,000 to 3,000 micrograms daily from supplements. The risks go beyond discomfort. A 2022 review in the European Journal of Clinical Nutrition found that excess vitamin A intake in older adults was linked to a 25% increased risk of atrial fibrillation, an irregular heart rhythm that significantly raises the likelihood of stroke. If you're over 65 and your multivitamin contains retinol or retinol palmitate, it's time to take a closer look. Your body needs vitamin A, no question, but the form matters. Foods like sweet potatoes, carrots, spinach, and eggs provide beta-carotene, a precursor to vitamin A that your body converts only as needed. Unlike retinol, beta-carotene doesn't accumulate to toxic levels, making it virtually impossible to overdose from food sources. Check your supplement label. If it lists more than 700 micrograms for women or 900 for men, you're flirting with danger, especially over the long term. The safest choice? Skip synthetic vitamin A entirely and rely on colorful fruits and vegetables for a steady, safe supply. Now, let's talk about another supplement that's often recommended to seniors but can turn into a silent threat: iron. Iron is a vital mineral known for fighting fatigue and treating anemia. It's commonly added to multivitamins marketed to older adults, promising to boost energy or strengthen brittle nails. But here's the reality most seniors don't hear. After 65, your body no longer loses iron the way it once did. Unlike water-soluble nutrients that pass through your system, iron accumulates primarily in your liver, heart, and pancreas. This buildup triggers oxidative stress, a process where unstable molecules damage cells, inflame tissues, and accelerate aging in your organs. It also promotes the formation of lipid peroxides, harmful compounds linked to Alzheimer's, cancer, and heart disease. The problem is, most seniors don't need extra iron unless they have a diagnosed deficiency, often caused by blood loss from surgery, ulcers, or chronic conditions. If you're eating a balanced diet with meats, beans, leafy greens, or fortified cereals, you're likely getting enough iron naturally. Adding a supplement on top of that tips the balance toward harm. Symptoms of iron overload are subtle joint pain, fatigue, memory issues, or heart palpitations, and they're often mistaken for normal aging. But behind the scenes, excess iron is damaging your brain, liver, and heart. High iron levels are harder to correct than low ones, and the damage can be irreversible by the time it's detected. If you're taking a multivitamin with iron, stop and consult your doctor. Ask for a serum ferritin test and transferrin saturation to check your iron stores. If they're elevated, you may need to cut back on red meat and stop iron supplementation entirely. Look for multivitamins labeled iron-free, especially those designed for seniors. Iron might have been a lifesaver when you were younger, but at 65, it can act like fuel on a fire your organs are too weak to extinguish. Next up is a supplement that's practically synonymous with senior health: calcium. For decades, calcium has been pushed as the ultimate bone protector. Featured in every ad for strong bones and every doctor's pamphlet, it's in nearly every multivitamin marketed to seniors. But here's what most people over 65 don't realize. Calcium supplements, especially when taken alone, can increase the risk of heart attacks, strokes, and dangerous artery calcification. This isn't an exaggeration, it's backed by science. Calcium is essential, but where it ends up in your body matters more than how much you take. When you were younger, your bones soaked up calcium like a sponge, guided by hormones and growth. Factors after 65, especially in postmenopausal women and aging men, this process slows down. Your bones don't absorb calcium as efficiently, and the excess doesn't just vanish. Instead, it can deposit in soft tissues, joints, and most alarmingly, your arteries. This leads to hardening of the arteries, raising your risk of cardiovascular events. Studies have shown that calcium supplements, particularly in high doses, can cause digestive issues like bloating and constipation, while reducing the absorption of other critical minerals, like zinc and iron, if you're taking acid blockers for reflux, a common medication among seniors. Your stomach struggles to absorb calcium properly, rendering the supplement useless while still posing risks. The better approach is to get calcium from food. Leafy greens, sardines with bones, yogurt, almonds, and chia seeds provide calcium in a bioavailable form your body can use without the risks of oversupplementation. If you need a supplement, ensure it's paired with vitamin D3 and vitamin K2, which help direct calcium to your bones and away from your arteries. If your multivitamin contains 500 to 1,000 milligrams of calcium, and you're already eating a calcium-rich diet, you might be overloading your system. Your bones need balance. Movement and proper nutrient guidance, not just more calcium. Your heart, meanwhile, needs you to keep calcium where it belongs. The most dangerous vitamin for seniors, however, is one that's often considered harmless: vitamin B6, particularly in high doses. Vitamin B6 is marketed as a nerve supporter, energy booster, and brain fog reducer. It's in countless multivitamins and nerve health formulas, and doctors often recommend it. But after 65, high doses of B6 can quietly damage your nervous system, weaken your muscles, and mimic symptoms of aging that are actually toxicity. Unlike other water-soluble vitamins that your body flushes out, B6 can accumulate in nerve tissue when taken in large amounts, becoming neurotoxic. This leads to tingling, numbness, burning feet, balance problems, and muscle weakness symptoms often misdiagnosed as diabetic neuropathy or simply getting old. The official upper limit for B6 is 100 milligrams per day, but research shows that even 50 milligrams daily can trigger toxicity in older adults over time. Many energy boosters, brain pills, and nerve support formulas contain 100 to 250% of the daily limit in a single serving. Combine that with a multivitamin and fortified foods, and you're easily pushing toxic levels without realizing it. Seniors are particularly vulnerable because of slower metabolism, reduced liver clearance, and conditions like diabetes or thyroid issues that already stress the nervous system. Once nerve damage begins, recovery is slow and sometimes incomplete. You still need vitamin B6, but in moderation, 1.5 milligrams for women and 1.7 milligrams for men, easily obtained from foods like chickpeas, tuna, turkey, bananas, and fortified cereals. Unless you have a confirmed B6 deficiency, verified by blood work, high-dose supplementation is unnecessary and risky. If your multivitamin or nerve formula contains more than 5 to 10 milligrams of B6 per serving, switch to a senior-specific formula or consult your doctor for a blood test. When it comes to B6, more is not better after 65. More could mean permanent nerve damage. Now that we've covered the vitamins to avoid, let's shift to the 4 essential nutrients you should take daily after 65 to stay sharp, strong, and healthy. These are ranked from least to most critical, starting with a mineral that's often overlooked, but vital for aging, magnesium. By the time you hit 65, your body's magnesium stores have likely dropped significantly. Aging reduces your ability to absorb magnesium, your kidneys excrete more of it, and common medications like diuretics, acid blockers, and blood pressure pills deplete it further. The result? Fatigue, muscle cramps, poor sleep, anxiety, irregular heartbeat, and insulin-resistant symptoms that creep in so gradually they're often mistaken for aging. Magnesium is involved in over 300 enzyme systems, regulating blood pressure, supporting nerve and muscle function, stabilizing blood sugar, and maintaining heart rhythm. It's also critical for brain health, with deficiencies linked to dementia, atrial fibrillation, and type 2 diabetes. Restoring magnesium levels can lead to better sleep, improved balance, fewer cramps, and sharper thinking. However, not all magnesium supplements are created equal. Magnesium oxide, a common form, is poorly absorbed and can cause digestive issues. Opt for bioavailable forms like magnesium glycinate, citrate, or malate, which are gentler on the stomach and better absorbed by aging bodies. Aim for 250 to 400 milligrams daily, depending on your diet and health status. Foods like leafy greens, avocados, pumpkin seeds, almonds, and black beans can help, but soil depletion has reduced magnesium content in modern produce, making supplementation often necessary. Next is a nutrient that's more than just a vitamin, it's a hormone that powers over 1,000 cellular functions, vitamin D3, after 65. Your skin's ability to convert sunlight into vitamin D drops by more than half, especially if you're indoors often, use sunscreen, or live in northern latitudes. Low vitamin D3 is linked to fatigue, bone thinning, muscle weakness, poor immunity, and a higher risk of infections. A 2020 review in the British Medical Journal found that seniors with vitamin D deficiency had a 50% higher risk of respiratory infections and a 30% higher risk of death from all causes, including heart disease, diabetes, and certain cancers. Vitamin D3 activates immune cells, reduces chronic inflammation, and supports memory, cognitive function, and mood stability. Low levels are strongly associated with depression and dementia risk in older adults. Most seniors are deficient, and standard multivitamins often don't provide enough to correct it. The recommended daily intake from food and sunlight is 600 to 800 international units, but studies suggest older adults need 1,000 to 2,000 international units daily to maintain healthy blood levels, especially in winter. If your levels are low, you may need more under medical supervision. Choose vitamin D3, cholecalciferol, over D2 as it's better absorbed and more bioactive. Take it with a fatty meal for optimal absorption, whether in liquid, soft gel, or capsule form. Getting your vitamin D levels tested can help you dial in the right dose, ensuring your immune system, bones, and brain get the support they need. The third essential nutrient is vitamin B12, a critical player in nerve health, red blood, cell formation, and brain function. After 65, your stomach produces less acid, which is needed to absorb B12 from foods like meat, eggs, and dairy. Medications like antacids or metformin further reduce absorption, leaving many seniors deficient without realizing it. The symptoms: tiredness, poor memory, tingling in hands or feet mimic dementia or arthritis. But over time, B12 deficiency can cause serious issues like unsteady walking, falls, and irreversible nerve damage. Food alone isn't enough for most seniors as absorption declines. With age, supplemental B12, in the form of methylcobalamin or cyanocobalamin, bypasses the stomach and is absorbed directly through the mouth or gut. Aim for 500 to 1,000 micrograms daily, taken as a tablet, sublingual lozenge, or weekly injection if you're severely deficient. A blood test can confirm your B12 levels, and addressing a deficiency can make your brain, muscles, and nerves function as if you're years younger. Don't wait for symptoms to worsen. Get tested and act early. Finally, the most critical nutrient for seniors over 65 isn't a vitamin but a class of essential fats, omega to 3 fatty acids, specifically EPA and DHA. These fats are among the most studied supplements with overwhelming evidence of their benefits. A 2021 study in the European Journal of Clinical Nutrition followed over 42,000 adults over 60 and found that those with the highest omega-3 blood levels had a 36% lower risk of death from all causes. Another study in Circulation showed that omega-3 supplementation reduced the risk of fatal heart attacks in seniors by over 45%. Omega-3 South protect your brain, heart, joints, and overall lifespan by reducing inflammation, keeping blood vessels flexible, and supporting brain tissue. Over 68% of Americans over 60 are deficient in omega-3 South, largely because they don't eat enough fatty fish like salmon, sardines, or mackerel. To get the amount your body needs, food alone often isn't enough. A high-quality fish oil supplement providing at least 1,000 milligrams of combined EPA and DHA daily is ideal, though those with heart issues or chronic inflammation may need 2,000 milligrams under medical guidance. Choose a supplement tested for purity, free of heavy metals, and in triglyceride form for better absorption. Take it with a meal to avoid any fishy aftertaste. For vegans or those with fish allergies, algae-based omega-3 supplements provide DHA directly. Omega-3 South aren't just about preventing heart attacks or strokes, they help you think clearer, move easier, sleep deeper, and age better. They form the structure of your brain and help your cells communicate, making them a nutritional insurance policy for staying sharp and strong well into your 70s and beyond. After 65, your supplement routine isn't about taking more, it's about taking smarter. The wrong vitamins can drain your strength, fog your brain, and strain your heart, even if the label claims they're for seniors. By cutting out the toxic extras vitamin A in retinol form, iron, calcium alone, and high-dose B6 and focusing on magnesium, vitamin D3, B12, and omega-3s, you give your body the tools it needs to thrive. Check your medicine cabinet, rethink your multivitamin, and talk to your doctor about testing your nutrient levels. Your future self sharper, stronger, and healthier will thank you.